Okay, confession. I'm an accountant. What do I know about healthcare? Now, my wife is a nurse, so I count on her, and she edited the hell out of this particular video because she knows stuff. COVID is a contagious disease caused by a coronavirus that created a pandemic in 2020. Complications can take many forms, leading to hospitalization and potential death. It spread rapidly across much of the world with virtually nothing known about the disease or how to eliminate the threat. It began in Wuhan, China. Can you find it on the map? It's in central China at the junction of the Yangtze and Han rivers with a long history. Well, back to the story. Presumably, COVID started with diseased animals and spread in the wet animal markets to humans. The World Health Organization and China claimed that, yep, the wet animal market was the source. Suspiciously, the Wuhan Institute of Virology was performing research on an extra potent coronavirus, especially as it became clear that COVID was extra contagious and virulent. The Wuhan Institute became the likely source with more pandemic and research experience. The result was a constricted global economy and partisan attitudes. All consider it a continuing mystery. Pandemics have continuously recurred throughout recorded history, beginning in the Fertile Crescent. Key events included the Justinian pandemic in the Byzantine Empire, the Black Death of the European Middle Ages, the British pandemic of 1666, along with the Great Fire of London, and multiple smallpox epidemics in the New World that wiped out much of the indigenous population. The Spanish flu pandemic of 1918 probably killed more people than World War I. Then came polio. COVID was just the latest. By the way, part of the answer included antibiotics and vaccines. We have modern medicine, vaccines and antibiotics, and well-stocked medical supplies. Granted, there are annual flu and cold seasons with vaccines not as effective as hoped, but still, what's the chance of a pandemic from a little-known cause? It soon became evident how ill-prepared we were. The WHO declared COVID a global pandemic in March 2020. Then came panic with lockdowns, travel bans, economic shutdowns, and an increasing number of dead. The initial U.S. response was emergency declarations, travel restrictions, social distancing, a dramatic increase in emergency room visits and hospitalizations. People clamored for face masks. Hospitals needed appropriate supplies to treat patients and protect hospital staff. Recreation venues, schools, universities, and stores closed. People worked from home using video connections. Essential personnel still went to work with protective covering and hope. Well, perhaps some good news. The economic shutdown resulted in reduced pollution, reduced traffic, and a slowdown of environmental destruction. Some of us even liked social distancing. The Trump team initially did a reasonable job dealing with the catastrophe. A White House coronavirus task force was established, which included Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. He often conflicted with the president on protection and treatment issues. Now, Operation Warp Speed led to the rapid development of vaccines, and a viable vaccine was available by the end of 2020. The initial economic stimulus was poorly designed, with confusion and fraud. It was based on the Coronavirus Aid, Relief, and Economic Security Act, with payments of up to $1,200 for adults and $500 for each kid. There was the strange Paycheck Protection Program with forgivable loans to small business, payments to hospitals and medical businesses, followed by litigation. The pandemic disrupted farming in several ways. There were labor shortages, supply issues, and uncertain demand. Labor, transportation, and international trade were problematic. Farm product pricing was erratic as primary markets disappeared. Restaurants were shut down, and even shopping was difficult. For example, much of the potato crop had to be thrown away. There was a presidential election in 2020 with increased partisan developments and a president who would not concede the election. Unfortunately, that became a part of the COVID story next time on Food History and Mystery.